Welcome to the deep dive. If you're involved in animal health, today we're tackling something pretty specific but really interesting: streptococcal dermatitis in Camelidae and Cervidae. We've gone through the sources, the research to pull out the key stuff, the surprising bits. Our mission today is basically to give you a shortcut to being really well informed on this without getting buried in detail.
Exactly. And it might sound niche, right? Camelids and cervids, but it's fascinating how the same type of bacteria behaves so differently. We're not just looking at what happens, but digging into why these differences are important. Helps you connect the dots.
Okay, let's unpack this then. Starting broad,
Yeah.
what actually is streptococcal dermatitis?
Well, fundamentally, it's a skin infection caused by bacteria from the Streptococcus genus. Different species can be involved. And these bacteria, they're pretty widespread. They can cause anything from just a small localized skin issue, maybe some pustules,
Yeah.
all the way up to really severe generalized skin disease or even systemic illness if the infection spreads through the body. And the crucial thing really is how it looks, how it presents, varies a lot between different types of animals.
Right, which brings us to the really interesting part. Let's zoom in on Camelidae first. So, camels, llamas, alpacas. Who are the main bacterial players here, and how does it show up in these animals specifically?
Okay, so for camelids, you're often looking at Streptococcus equus of species epidemicus, or maybe Streptococcus dysgalactiae, or other related beta hemolytic streps. Often they're opportunistic. They need a way in, like broken skin or a stressed animal.
Opportunistic, okay.
The Streptococcus equus of species epidemicus, that one's particularly important. It's a Lancefield group C strep. And in North American camelids, especially llamas and alpacas, it's known as a primary pathogen. It causes something often called alpaca fever.
Alpaca fever. That doesn't sound like just a skin problem. Is it more serious?
Oh, absolutely. That's the key distinction here. Alpaca fever isn't typically your straightforward skin dermatitis. It's usually a severe systemic illness.
Systemic. Wow.
Yeah, you see really serious signs. High fever, the animal is depressed, won't eat, and this thing called polycerasitis. That's inflammation of the membranes lining the chest and abdomen. It can lead to awful complications: pneumonia, peritonitis, pleuritis, even meningitis or endocarditis.
Good grief. That sounds incredibly dangerous.
It is. And here's a really alarming part. The mortality rate can be staggeringly high. Sometimes 50%, sometimes even up to 100%.
50 to 100%.
Yeah. And things like stress from transport or even just shearing can sometimes trigger this systemic infection in animals that were maybe carrying the bacteria without showing signs before.
So a seemingly healthy animal could suddenly develop this after shearing.
It's possible, yes, if they're a carrier and the stress tips the balance. We also see Streptococcus agalaxia. That's a group B strep in camelids. That one is more directly linked to a skin condition called infectious skin necrosis. So a true streptococcal dermatitis. It can also cause mastitis and lymph node issues.
Okay, so S. epidemicus often means systemic alpaca fever, high mortality, whereas S. agalaxia is more the direct skin necrosis route, but still serious.
Exactly. Two different presentations from related bacteria in the same animal group.
Going back to the general skin infection side, not necessarily alpaca fever, how do camelids typically pick it up, and what are the visual signs on the skin?
Right. So transmission is usually through direct contact with an infected animal or maybe contaminated bedding equipment. Fomites, basically.
Makes sense.
And the risk factors are pretty intuitive. Any break in the skin barrier is an open door wounds, scrapes, insect bites. Even just skin getting soggy and damaged from being constantly wet. Poor hygiene, damp or humid conditions, overcrowding, and anything that suppresses the immune system all make it more likely.
And what would you see if you're looking at an alpaca, say?
You typically look for localized lesions first. Little pustules, maybe raised bumps called papules, crusts forming, often on the face, neck, legs, or anywhere there's been some trauma. The skin underneath might be red, swollen. If it gets worse, it can become generalized, widespread, crusting, oozing, hair loss. And if it does start to spread internally from the skin infection, you might then see those systemic signs kick in: fever, lethargy, not eating.
Gotcha. So how do vets nail the diagnosis, and what's the approach to treatment, and importantly, prevention?
Diagnosis usually starts with the clinical picture, looking at the animal, the lesions. But to confirm, you really need bacterial culture. So taking swabs from the lesions or maybe aspirating fluid from a pustule and sending it to the lab to identify the Streptococcus species.
Okay.
Sometimes a skin biopsy, histopathology, can help too. It might show characteristic inflammation patterns with bacteria visible.
And treatment.
Systemic antibiotics are usually key, especially if it looks severe or widespread. Things like penicillin or cephalosporins are common choices. For very localized cases, topical antibiotic creams might be used. And wound care is crucial, cleaning the affected skin with antiseptics, gently removing crusts. Plus, supportive care, making sure the animal stays hydrated, gets nutrition, managing any pain.
Right, the whole picture.
Exactly. And prevention really boils down to good husbandry, good hygiene, good biosecurity, treating wounds quickly, and managing the environment, trying to reduce exposure to really wet, humid conditions is a big one. Keeping bedding clean and dry.
And the outlook, if they get treatment.
Generally pretty good if you catch it early and treat it properly. But for those severe systemic cases like alpaca fever, or if treatment is delayed, the prognosis is much more guarded.
Okay, that's a really clear picture for camelids. Now, let's pivot. What about deer, Cervidae? Is it the same story, or does Streptococcus play by different roles here?
Well, this is where it gets quite distinct. What's fascinating is that specific syndromes that are clearly defined as streptococcal dermatitis, like a widespread skin disease, aren't actually well documented in deer in the same way.
Really? So you don't typically see that kind of generalized skin condition?
Not commonly reported as a primary streptococcus syndrome, no. While deer certainly can get streptococcus infections, species like Essekegi subspecies, Zooepidemicus, and S. discalacyi are found in them too, their role seems more limited. They tend to act more as opportunistic invaders, primarily causing abscesses.
Ah, okay. So abscesses are the main manifestation rather than that kind of inflammatory dermatitis we just discussed.
Exactly. Streptococcus species are actually among the most common bacteria isolated from abscesses in deer. Usually follows some kind of injury, a wound, that lets the bacteria get in under the skin. These abscesses might stay localized, just a lump, or they could potentially spread, maybe cause deeper tissue damage and lead to more serious illness that way.
Interesting. So the bacteria are there, but they cause a different type of problem.
Pretty much. And it's worth noting, other streps like S. equinus and S. equisimilis have also been found in deer, but those reported cases were linked to things like pneumonia, again, not skin disease specifically.
So what about the risk factors for deer? Are they similar to camelids? And the general approach to treating these abscesses or any skin lesions that do occur?
Yes, the underlying principles are very similar. Transmission risk comes from direct contact, contaminated environments, and especially skin wounds acting as entry points.
Makes sense.
Environmental stressors, poor hygiene, overcrowding these definitely increase the risk, particularly their abscess formation after an injury.
And the clinical signs, if it's not just an abscess?
If there are skin lesions, they might look like reddish bumps, pustules, or crusted areas, often right where a wound was. It's possible to get more severe signs, widespread oozing, crusting, hair loss, maybe systemic signs like fever and lethargy, but again, that seems less common as a primary strep dermatitis compared to camelids. The focus is really more on those abscesses.
Okay. And diagnosis, treatment, prevention, still similar?
Largely, yes. Diagnosis relies on clinical exam, maybe culturing pus from an abscess or a lesion. Histopathology could be used. Treatment usually involves systemic antibiotics, especially for abscesses or more significant infections. Topical treatments might be used for minor surface lesions. Wound care is important if there's an open wound, and supportive care if the animal is unwell.
And prevention.
Again, good hygiene, trying to minimize overcrowding or situations that lead to injuries, keeping bedding or resting areas clean and dry, prompt attention to any wounds, reducing exposure to persistently moist, dirty environments.
Right. And the prognosis for deer.
Generally good for localized issues like a simple abscess, assuming it's treated appropriately. But it becomes more guarded if the infection spreads systemically or becomes very severe, just like with camelids. So if we try and sort of connect the dots here, bring it all together, the really key takeaway is this nuanced difference, isn't it? How Streptococcus behaves in these two groups. For camelids, particularly llamas and alpacas, you have S. equi subspecies, Zooepidemicus, posing this major, often systemic threat, alpaca fever, with potentially devastating mortality,
Yeah.
and then S. egalaxia causing that direct skin necrosis.
Yeah, very distinct threats.
Whereas in cervids deer, Streptococcus seems to be much more of an opportunist, primarily causing abscesses following injuries. We just don't see reports of a common, distinct, widespread streptococcal dermatitis syndrome in the same way.
So it really underscores that it's not just about knowing the name of the bacteria, is it? It's about how that specific bacterium interacts with a specific host species. And that interaction seems heavily influenced by, well, environmental factors, maybe host genetics, other stressors. It's complex.
Precisely. The host-pathogen interaction is key.
We have definitely taken a deep dive today. We've uncovered these really distinct ways streptococcal infections hit Camelidae versus Cervidae, from that potentially lethal alpaca fever to the more localized abscess issue generally seen in deer. Hopefully, you listening now have a much clearer, more comprehensive handle on this topic, distilled from what we've looked at.
Yeah, and what this really means for you as someone learning about this is seeing how one single bacterial genus, Streptococcus, can paint such different clinical pictures. It pushes you to think beyond just strep infection and consider the specific bug, the specific host, and the specific circumstances. It's all connected.
Absolutely.
Yeah.
So let's leave you with a final provocative thought to chew on. Given these fascinating species-specific differences we've discussed, how might really digging deeper into understanding this kind of specific pathogen behavior, how might that actually revolutionize the way we approach disease management, maybe even conservation efforts for all sorts of diverse animal populations out there?
Something to mull over as you continue your own deep dives into the world around you.